Let me thank you very much for asking me to give some personal impressions from the meeting. Actually, the title that was just read is my previous title. I'm now the retired Director General and Chief Medical Officer, but I still act as a senior expert advisor to the ministry, and I'm also chairing the steering committee of the European Observatory on Health Systems and Policies. And my point of view in this brief 10-minute presentation will be more on the aspect of health systems strengthening and universal health coverage of the Global Health Forum. Oh, great. Thank you so much. I appreciate your effort.
Hey, thank you so much for waiting.
Okay, no problem. Now, can I have the next slide, please? Let me first say that the Global Health Impact Joint Action is quite a comprehensive effort, in my opinion, and you have to be congratulated for having recruited so many institutions and plenty of expertise and know-how to cover the EU's global health strategy's main aims. So the starting point of the joint action looks very good to me. Can I have the next slide, please? So on the very same day that we had the Global Health Forum in Brussels, WHO published the annual report of World Health Statistics. I have just picked a few points from the media alert, putting an emphasis on access to essential health services without financial hardship, countries holding back by underinvestment in primary health care, shortages of skilled health workers, and so on. And these all contribute to the lagging behind of some of the goals that have been set to global health, despite the fact that there has been progress in reduction in tobacco use, improved air quality, better access to water, hygiene and sanitation, the so-called usual stuff of global health. So the emphasis in this report was put more on universal health coverage and strengthening health systems. And finally, of course, and as has been mentioned in this meeting already, recent disruptions in international aid were mentioned, and they will further threaten the stabilization of progress that was reached before 2019, although it already had shown some signs of slowing down before the COVID crisis, which of course exaggerated that development. Now, the objectives of the forum, which I believe was the first of the kind arranged by the European Commission, the objectives are listed here, and maybe the most important of those was keeping global health high on the EU global agenda. Now, the question that was made to us, expert level panel members, was what did we learn from this meeting for the joint action activity adaptation, which is an important word here. Can I have the next slide, please? Well, said and heard by me, and these are my very personal reflections, because the actual report is still pending. Global health remains relatively high on the EU agenda. And the agenda is still mostly valid, but the scenario and resources have changed, so the implementation must also change. These are more or less direct quotations from the presentations. Health security is number one, but also addressing inequity and capacity gaps in the health systems, particularly in preparedness, were mentioned. And it's also a fact that inequities exist within and between member states. There is, for example, a 10-year difference in life expectancy between the member states. And strengthening health systems is the key to comprehensive improvement, and without universal health coverage, nothing can be achieved. This is also a direct quotation. Many of the challenges of global health, which were reflected in the presentations and also in the questions and answers, have been there previously, but the geopolitical crisis has emphasized them and brought them to surface. But what is perhaps new is that health is no more and not to everybody a value in itself as we used to think, as it used to be. But the impact of our efforts to improve health and the returns of investment, a demonstration of impact and returns of investment are essential. And it was also pretty clearly mentioned that with external funding comes political influence. And the question was made that has public-private partnership gone astray because of this becoming stronger and stronger? This was particularly mentioned by Professor Kateriini Stureng from Oslo University. Monitoring efficient use of resources, national level coordination of the resources that come from various sources, the Lusaka agenda, which was also mentioned here before, and research and evidence to support global health political guidance were also important topics in the discussion. And as has been mentioned here before, WHO remains the cornerstone of the multilateral health system. And the reorganization of the WHO, of course, is pressurized to be more cost effective. But it was also pretty clear that regional interests and organizations may be becoming increasingly important when the global ones are losing influence. Can I have the next slide, please? So keeping in mind the objectives of the forum, what could we perhaps derive from the discussions and the presentations for the context of the joint action activity adaptation? Well, it was pretty clear that EU will remain an important actor of the global health arena, and that was very clear also in the previous presentations. What about the stakeholder involvement, which was one of the objectives of the forum? I would say that the impressions and the presentations and the presence was variable, and it was quite difficult to sort of draw any final conclusions from this part of the program. Dialogue was expected, but there was also some confrontation, more or less clear. But on the other hand, positive statements like potential start of the new global health sunrise, which will come with a global health paradigm change and the new vision for 2035. Well, I would perhaps like to use the Finnish word sisu here, that there was this sort of feeling that even though global health financing is fragmented and we perhaps don't know where it is, what the needs are, so there's no way to turn around, and we just have to create the new vision and the new ways of cooperation and new architecture for global health. But to be honest, there was some sort of a lack of leadership in the room, maybe because of the format of the meeting, which was quite heavy and maybe even difficult to follow for some of us. Can I have the next slide, please? My personal opinion is that the joint action has produced remarkable outputs so far, and sustainable results are achievable with this when we take them further. Of course, what are going to be the home bases of the new architecture is an important question, and the whole role of the EU in the renewal of this architecture is maybe still a little bit unclear. The key issue is, of course, that can global health make it back to the political agendas beyond pandemic preparedness? Maybe we have to adopt a little bit different language and framework for our key messages. Speak of whole of society approach, health systems resilience, economy of well-being, you name it. The member states' interest is key. they have to pursue their political influence and responsibility to reach the global health goals. And I would like perhaps to draw your attention to the forthcoming United Nations Second World Summit for Social Development, which will be held in Doha in November this year. Health is pretty much present in the agenda of this meeting. And I think that's what is happening in many member states also, that health is more and more being seen as part of the whole society. It has co-benefits for other sectors, and it's also dependent on the other sectors to reach its own goals. But there was also this question in the air. Was there sufficient sense of urgency and need to act in that forum? And I leave you with a question and 3 recent papers in Lancet, which will give food of thought from that point of view. And in my final slide, I will put my European Observatory on Health Systems and Policies hat on my head. Can I have the last slide, please? I will just like to remind us all that health is central to people's lives, and it's always one of the top values in different kinds of surveys, but it has an underappreciated influence on politics, which is quite nicely described in this pretty recent policy brief from the European Observatory on Health Systems and Policies. Health and politics exist in a self-reinforcing cycle. People with poor health are less likely to vote, and stigmatizing experiences and distrust in public institutions also undermine their trust in the health system, government, and democracy. And rebuilding trust in democratic institutions starts by ensuring that those institutions, including the health systems, meet the public's needs. That's what I had to say. Thank you very much.
Good morning to all. Apologies, I had some difficulties in connecting, but very, very happy to join this conversation and be able to share with you some reflections that have arisen from that day, very rich day that we spent in Brussels discussing the evolution of global health and the changes, the radical changes that are currently occurring in global health. First, I'd like to say how during the meeting it was very clear that we've entered a new era. And just the size of the speed of the change is absolutely dramatic. We now hearing that there will be a decrease in overseas development aid for health or development assistance for health, depending on how we frame it on the financial accounting, by 40% to 50%. We also know that the traditional institutions that are working on the global health agenda are all facing financial difficulties and will most probably have to work with reduced resources over the next years. At the same time, it was also very clear that the needs have not gone away. And if anything, the unfinished agenda of equity, universal health coverage, reaching the vulnerable is still here. That in fact, on UHC, we are stalling, that we have a risk of moving backwards if some interventions that were funded heavily through development aid are no longer delivered, and that's certainly the case for HIV treatment and other HIV-related interventions that were heavily dependent on US funding. And that not only the unfinished agenda, but the new agenda that is emerging of environment-related, planet-related health issues. We start seeing the question of health being severely affected by climate change, particularly through nutrition and food security, but also the quality of nutrients in a world affected by climate change, the question of biodiversity, of pollutions that is also arising, linked to pollutants. I'm saying that question of pollution that leads to questions on increase in cancers linked to pollutants, but also questions like AMR that also are related to our technologies and the way we are using in our global health activities. So we have on one hand an unfinished agenda, even on indicators that had shown some important progress, like the HIV indicators, child mortality, maternal mortality. We see the potential for this to plateau or even regress, but also new issues emerging linked to the profound changes in the ecosystem that we are all facing. And what we hear is a sense, and it's what struck me during the meeting is how everybody agrees that we've entered a new era. Everybody agrees that the global health architecture needs to change, but at the same time, there is no clarity on how this will happen and what these reforms will be. And in a way, we are in that fog of transition, knowing that we will have to build a new world, but not knowing yet what this new world will be. And certainly, it's been mentioned several times, the shocks that are coming on the UN system, the questions on the trust in the multilateral system. We know that the UN system is undertaking a major reform that will be announced probably in September. And we don't really have a clarity on what is ahead. And the Lusaka agenda that was discussed during the meeting still provides a bit of an old world type of solution. It is very similar to the IHP agenda, International Health Partnership, that has been around for some time, and the harmonization and alignment agenda that was launched in Paris and followed up in Accra and Busan, and is mostly about the old institutions to coordinate better, which we know is highly desirable, but has not quite happened since the literature shows us, since an analysis of the World Bank, that if anything, fragmentation has been increasing over time, and we don't really have a clear way forward on how to address this fragmentation. I will particularly emphasize as a second point the fact that countries are really asking for something different. And post-COVID, clearly, their main request, and we see it in the different fora where we meet as financing institutions, as public development banks, countries ask for funding to come to them. I think there is increasingly a demand from countries that the resources go directly to the front line, that they go to countries, that they go to local governments in the countries, that they go to communities in the countries, and that we need to make our global health actions much more efficient in reducing overheads and that are created by this fragmentation. And one thing that we always need to keep in mind is that the global health architecture as we have it had a major substitution effect on domestic funding. it actually displaces domestic funding. And when the US government very brutally cut its external funding a few months ago, we saw actually the reverse happening, sort of bringing an additional level of evidence on the substitution effect, with countries immediately increasing domestic financing in the aftermath of these cuts. That's the case of Nigeria, that replaced the missing funds through its own domestic budget. That's the case of Ghana, of Malawi, and to some extent other countries like Côte d'Ivoire. So there's been an immediate reaction, and there's been no outcry to re-establish the model that we had over the past 20 years. But on the other hand, much more of a demand from countries, which we could hear during the meeting, that we accelerate the reform to make sure resources are used to benefit countries and are used to encourage domestic financing. That means that probably one of the avenues we need to work on is really accompanying the transition with programs that help countries implement that domestic financing agenda. That means helping countries with developing taxation models. It is actually quite staggering how many countries, including African countries, have moved very rapidly on the health taxes agenda, sort of win-win taxes that bring both revenue that can be used for universal health coverage, but also influence markets and behavior towards less consumption of harmful products and more consumptions of healthy products. That's the case of the sugar tax that is implementing in an increasing number of countries, but interestingly is also included in the financing plans of UHC, along tobacco tax, and along more and more new ways of developing progressive taxation, either through VAT on luxury products or some kind of income tax. So there is the taxation agenda, there is the public financial management agenda, and there it was clear also that the European experience and the fact that Europe has some of the best UHC systems in the world is an asset for developing partnership programs in which Europe can work with African countries and other countries to work together at building the UHC institutions and the capacity of countries to mobilize domestic funding and domestic institutions towards health. So that's really an agenda that is emerging, but we don't quite know how to support it, because the institutions we have now have been really geared by and towards development assistance, and they really need to shift from that objective to move towards that transition towards domestic financing. And last, maybe my last point, which I was very impressed in the discussion, is the discussion on pandemic preparedness. First, with a success, I would say, of the EU on the medical products production and sovereignty agenda. There's been a lot of resources mobilized by EU countries on this agenda over the past 2 years. It's been probably one of the fastest exercise. In this sense, a true success of mobilizing funding and spending it, and a true success of public-private partnerships with actions that cover the whole range of issues that need to be addressed for that agenda, including regulation, support to public institutions, including investment climate with the support that was provided to Senegal for the development of its biomedical industry, including research and technology transfer, with the support to the South Africa hub, but also to the countries that are part of this, including Egypt, and support also to the private sector. A really very interesting success in this sense of having both public and private investments, particularly with the investments in vaccine production through Aspen in South Africa. And the part of that also, of that success, I think, can be identified with the experience of the pandemic fund that was presented, and show how we now have an instrument that can use grants that are mobilized by the global community for global public goods to leverage and activate domestic financing at country level, using the funding from public development banks, be it the World Bank, the Inter-American Development Bank, the Asian Investment Infrastructure Bank. And that's something that, again, we're very good at in Europe. We're very good at public-private financing. We know how to leverage how to use public financing to leverage private financing. And we need to do more of that with countries in transition. But I will conclude by saying that there's still a long way to go. We could hear a sense of frustration, particularly from the civil society, about how slowly the reforms of global health are going. We could really hear from our partner countries the frustration on how they still don't see how the funding in the new world will help them raise domestic financing, rather than being managed outside of their national policy framework. And that is something in which we really need to think more about. It was clear that Europe has a lot to bring in terms of simply sharing its experience on how to develop public health systems and to create UH institutions, and could really do better in this way by really developing partnerships between the EU and the AU, between the EU and ASEAN, and other regional organizations, so that we can really continue to focus on actions that are the nexus of human progress and health outcomes, but also values and economic interests. It's what I heard is a lot is it's about values, and it's about how we will continue to promote the values of our European health systems, of both solidarity and the kind of social contract that delivers on health outcomes. Thank you.
Thank you so much, Dr. Soucat.